Hi guys, welcome. Just give it maybe 1 or 2 more minutes to let some more people join, and then I'll go ahead and start today's webinar. Okay, it looks like we have a few people here. So let's get started tonight. So just to remind you all, my name's Dr. Chelsie Rohrscheib. I'm the head neuroscientist and sleep specialist at Wesper. We are a sleep health company, and I like to do these weekly webinars on Wednesdays to really help educate people about various sleep topics, especially related to sleep disorders like sleep apnea. So a lot of you who are joining us today have come from sleep apnea groups and forums on Facebook, so welcome. If you're new here, generally what I do is I'll discuss today's topic, which is related to sleep and sleep apnea and how that relates to mental health. And then I'll take a few minutes afterwards to answer any questions you have. So if you have a question, leave a comment below. I'm happy to respond. Alternatively, if you send me a direct message through this Facebook group or my personal Facebook page, I'll respond to you privately. So again, welcome everyone. So just to remind everyone what today's topic is we are talking about sleep and mental health. So it's pretty obvious that sleep affects mental health. Most of us, if we've been sleep deprived for a few days, we start to feel moody or stressed. And we know that chronic sleep deprivation can really raise your risk for a handful of mental health disorders. Very specifically, things like depression and anxiety are typically highly affected by sleep loss. So sleep and mental health go hand in hand. I always like to say they're married to each other because when you're sleeping poorly, that can affect your mental health. And, conversely, mental health disorders can also affect how well you sleep. So they're in a marriage, and when one starts causing problems, it just snowballs out of control until your mental health gets worse and your sleep gets worse. So let's talk about why sleep specifically affects mental health. Well, sleep is a very dynamic process in the brain. And what I mean by that is sleep accomplishes many different important biological functions. It's not just about turning your brain off and having a rest. It's about accomplishing all of these biological functions that you simply can't do while you're awake. And this includes things like cell and tissue repair, brain waste clearance, hormone release, and relating to mental health specifically, one of the main things that sleep does, especially during that deep, slow wave restorative sleep, is it kind of fine tunes the neurons in our brain. Those are the cells that are responsible for things like consciousness and controlling the rest of the body. So it goes through each neuron and it kind of fixes those neurons and repairs those neurons and fine tunes how they communicate. So you can imagine that when you're chronically sleep deprived, that job isn't going to be getting done, and those neurons are not going to function properly the next day. And this can really lead to issues and challenges with your mental health. The other thing is that sleep really helps work on the areas of the brain that are responsible for things like stress and emotion. And when we don't get enough sleep, those areas of the brain can get too stimulated. We can have a more difficult time dealing with stress, and we can have a really hard time controlling our emotions, especially negative emotions. So getting high quality sleep is absolutely essential for maintaining good mental health. Now, conversely, let's talk about how mental health itself can go on and affect sleep. So if you do have an existing mental health disorder, almost every single mental health disorder affects sleep in one way or another. So people with chronic depression tend to have insomnia, they tend to sleep too short, or on the other hand, a lot of people with depression also tend to oversleep. So they'll sleep too much, they'll take too many naps, and this really disrupts our normal sleep cycle and the way sleep actually affects the body. Anxiety, which is another super common mental health disorder, which very high percentage of the American population has. It's no secret that anxiety affects sleep. It's typically one of the main culprits in developing insomnia, especially onset insomnia, so the inability to fall asleep, but it can also affect maintenance insomnia. So that's an inability to maintain sleep throughout the night. So, and that's just two examples. Other mental health disorders like ADHD, schizophrenia, bipolar disorder, OCD, they all affect sleep as well. And that kind of makes sense because mental health disorders are, they're essentially affecting our neurochemistry and how our brain works. So if we're affecting the neurochemistry of the brain, we're also going to accidentally affect sleep. So now that we know that sleep and mental health are so intimately related to one another, how do specific sleep disorders come into play? Because obviously, it's one thing to just have really poor sleep habits or not sleep enough. It's another thing altogether when you have a sleep disorder. Let's talk about sleep apnea specifically. So we know through various clinical studies that sleep apnea is highly associated with certain mood disorders, in particular, depression and anxiety. So it's something like 46% of people with sleep apnea have some form of depression, and about 57 to 60% of people with sleep apnea have some form of anxiety. So this kind of makes sense in a way if you think about it, because sleep apnea, even though it seems like we're getting enough sleep, it seems like we maybe are getting 8 hours or more a night, is actually very sleep depriving. And that's because sleep apnea causes you to stop breathing periodically throughout the night. And if you do this enough times, what's going to happen is your oxygen levels are going to drop, and your brain can detect that drop. So your brain is constantly sensing how much oxygen is in the blood. And when it senses that your oxygen has dipped too low, it will trigger you to wake up to recommence breathing, even very briefly. So sometimes we call these micro awakenings, so they last seconds, to the point of where you don't even realize you've woken up. But what this is doing is this is taking you out of that deep restorative sleep. So you're constantly in this cycle of light sleep or being awake throughout the night. And so you're essentially sleep deprived, even though, people with sleep apnea can sleep up to 12 hours a day. So just as we spoke about how sleep deprivation can lead to raising your risk of having certain mental health disorders, sleep apnea does the same. So, depression and anxiety are only two mental health disorders that are associated with sleep apnea. Some clinical studies have found associations between PTSD, which is post-traumatic stress disorder, schizophrenia, OCD, and a whole range of other disorders as well. So what can we do if our sleep apnea is making our mental health decline, or if we already have a pre-existing mental health disorder? How can we prevent sleep apnea from making that worse? Well, there's 6 major things that you should be doing if you are suffering from anxiety or depression when you have sleep apnea. And I'm going to go through that list now. Let me just check to see if there's any comments. Okay. If you have any questions, feel free to chime in. I'm having a little bit of an issue seeing some of the questions here. So if I don't end up seeing any, please feel free to direct message me and I will get back to those as soon as possible. So let's talk about the first thing every sleep apnea patient should do if they are having mental health struggles. So first, it's finding a treatment that works for you. So I've discussed this in previous webinars, but oftentimes what happens when you're a patient, you get diagnosed with sleep apnea, is 9 times out of 10, you're going to immediately be placed on a CPAP machine. And that's not necessarily a bad thing. The problem with CPAP is that it can be very difficult to get used to using. The time it takes to get used to using a CPAP compared to other treatments is pretty long. So it's roughly about 4 to 6 weeks. Some people take less time to get used to using CPAP, and some people take longer. And one of the unfortunate side effects of using a CPAP is before you get used to it, it's generally very disruptive to your sleep because it's uncomfortable to wear. You've got a mask on your face delivering pressurized air into your throat, and it's not the most comfortable way to try to fall asleep. So that in itself, with the stress of trying to use it properly and also being sleep deprived for the first few weeks that you use it, can really raise your mental health levels, or really reduce your mental health levels, I should say. So if you're really struggling to get used to your CPAP and you've been at it for a while, then it may be in your best interest to speak to your doctor about alternative treatment options. So there's a wide variety of sleep apnea treatments available. Not one size does not fit all when it comes to treatments. So some treatments may be more appropriate for your situation than it would be for others. So it's really important to have that discussion with your doctor to see what your options are. Just to give you some examples of some of these treatment options. So one would be something called a mandibular advancement device. And that's an oral appliance that is made by a dentist that specializes in sleep breathing disorders. And essentially it works kind of like a mouth guard that you wear while you sleep. So you pop it in your mouth and it pulls your lower jaw just ever so slightly forward. And this action of pulling your jaw forward and stabilizing it during the night really helps open your upper airways and allows you to continue breathing throughout the night. Now, compared to CPAP, most people can get used to using a mandibular advancement device pretty quickly. And because it is custom made to your mouth, it's not as bulky or as uncomfortable. If you wanted to go down this route, you would first need to speak to your doctor or speak to a dentist that specializes in sleep medicine to determine whether it's actually going to be appropriate for you and whether it's actually going to reduce the amount of apneas that you're having at night. Another common treatment is called positional therapy. And positional therapy is very specific to individuals who have positional sleep apnea. Some of you have probably heard of positional sleep apnea. Some of you might even have positional sleep apnea. Positional sleep apnea basically means that you're only having sleep apnea symptoms, so you only stop breathing in one sleeping position. The majority of the time, that sleeping position is on your back, or the supine position. And this makes sense, really, if you think about it, because when we sleep, our muscles relax and our tissues relax. And when we're laying on our back, gravity pulls all those tissues and relaxed muscles backwards, and that can cause the blockage in your upper airway. So some people who sleep on their side, no longer have these apneas. And so using positional therapy is a really easy fix, which is essentially just getting you off of your back using various devices and pillows and wedges so that you can breathe properly at night. Now, that is a very cost-effective way of treating your sleep apnea. You don't necessarily need a prescription. A lot of these products you can just purchase online, and they're pretty cheap. A foam wedge isn't going to cost much. There are electronics that are a bit more expensive, but it really just depends on what you're interested in trying. Another treatment would be something like the Inspire device, which is an electronic implant that goes into your chest and stimulates a nerve in your neck called the hypoglossal nerve. And you turn it on and off at night. And when that nerve is stimulated, it helps your muscles maintain tone so you don't stop breathing. And these are just a few of many different examples of sleep apnea treatment. So if using a CPAP or any other treatment is causing you stress and anxiety, is making you feel depressed, is affecting your self-confidence, then don't be afraid to speak to your doctor about potentially going on another treatment. Okay. Number two is fix your sleep hygiene. And you're probably asking, well, why do I need to fix my sleep hygiene if I treat my sleep apnea? Well, here's the thing. Yes, treating your sleep apnea will help you breathe better at night, but the majority of us are still not sleeping properly because we've developed all these horrible habits that are affecting the general quality of our sleep. So these are habits like not keeping a consistent sleep schedule, so not going to bed and waking up at the same time daily, not allowing ourselves enough time in bed to get the amount of sleep we actually need. So it's completely different to be in bed for 7 hours than actually being asleep for 7 hours. So even if you set your alarm to wake up at 7 hours later, you may only get 6.5 hours of sleep, and that's simply not sufficient for your overall health and wellness. Other things that are super important would be keeping a very comfortable, cool, calm, dark bedroom environment that's not distracting, are not likely to wake you up. Making sure that you're not consuming caffeine too late in the day. So your caffeine window should be 6 hours. So no caffeine within 6 hours of bedtime. If you're extra sensitive to insomnia, then maybe push it up to around 8 hours. Try to dim your lights in your house and reduce your electronic screen time for at least an hour before bed to help your brain understand that it's nighttime and it's time to go to sleep. Some other things you can do that also directly affect mental health as well is getting plenty of natural sunlight during the day. And when I mean during the day, I usually mean in the first half of the day. So from the time you wake up until about midday. And this is because natural sunlight not only helps you increase your vitamin D, it helps combat seasonal depression, but it also regulates your circadian rhythm. So that's the 24-hour biological clock that tells us when to go to sleep and when to be awake. If you're interested in learning more about improving your sleep hygiene, you can go on the Sleep Foundation website. They have great resources, or just reach out to me if you have specific questions. So, you can't just treat your sleep apnea. You have to do it in combination with good sleep hygiene to maximize your mental health. Okay. Number three is a really important one that I think most of us don't follow, and that is stress management. So we live in a highly stressful society. We work crazy hours. We have all these commitments, and we're absolutely terrible at self-care and taking care of ourselves in general. And so adding in some stress management techniques into your life can really help bring that anxiety down and switch your nervous system over from fight or flight mode, which is very typical when we're having anxiety, to more of a rest and digest mode, which is really what we need to sleep properly and just feel good. So stress management techniques would be things like deep breathing exercises, meditation, making sure you're getting enough exercise during the day, putting your work away enough hours before you go to bed, and also allowing yourself a little bit of you time during the day. So we do a pretty horrible job at fitting in me time, time where we can relax and do something that's enjoyable for us. So implementing some of those techniques is going to go a long way in just bringing your nervous system down and making you feel better in general. And it's also going to have a major impact on your sleep quality as well, because we know stress is one of the number one killers of sleep quality. Number four is focusing on improving your health. So, we've talked about treating your sleep apnea, but that's just one tiny part of the puzzle. It's just one piece of the puzzle as far as your health goes. You need to look at the bigger picture. So yes, you're improving your breathing, you may be sleeping better at night, but there's other aspects. You have to look at things like diet and exercise. If you have any other medical conditions, whether they're well controlled, your mental health, of course. I mean, this is the whole point of the talk. You have to implement other things into your life that are going to improve your overall health. Because if your body is not healthy, your brain is not going to be healthy, and that's going to ultimately make your mental health worse. Number 5, get a decent support system. So when I say support system, I mean keep family and friends around who understand your situation. They understand that you have sleep apnea. They understand your struggles and can be a shoulder, for you to talk on. If you need to have a conversation about how stressed you are, if you need somebody to take your kids for a few hours so you can really relax and, get rid of a lot of that stress. Somebody at work who can maybe take over some of your work responsibilities for a few hours. Just any group of people that you can keep around you that are there to help you out when things get too intense or your mental health issues, rear their ugly head is super important. Now, I'm completely aware that not everybody is going to have that support system in place. So there are other avenues that you can use. You can use a mental health professional, for instance. There's a lot of online support groups. I know that many of you are already involved in these because several of you have come from Facebook support groups for sleep apnea. There's a lot of video chat groups that you can meet up with, especially if you have things like anxiety and depression. There are weekly groups where you can go and talk to other people who are in a similar situation, discuss your day, discuss how you're feeling. And sometimes just the act of talking to other people who understand what you're going through is very therapeutic. And finally, seek professional help. So if your stress and anxiety or depression are becoming unmanageable, or you're really struggling with your sleep apnea diagnosis, then it's probably a good idea to talk to a mental health professional. You can start with your personal care physician and see what they would recommend. And usually they're going to point you towards a therapist who can do some cognitive behavioral therapy or some other form of therapy to help you really tackle your mental health issues head on. So there is absolutely nothing wrong with seeking help for your mental health issue. And, you don't have to tell everyone about it. You don't have to be super vocal about it, but just having that support system there and somebody who can really professionally listen to you and offer you professionally, clinically validated advice is a huge game changer. And some people, you may need to go on medication or you may need other forms of therapy for your mental health disorder, but that's okay because they're professionals, they're there to help, and they're going to monitor your progress. Okay, so today we talked about how sleep affects mental health, in particular depression and anxiety, and how sleep apnea in particular can affect mental health. I'm happy to take any questions you have. I can see that I'm not getting questions on this screen. So what I'm going to do is I'm going to flip my phone around so that I can actually see all the questions you have. So just give me 1 second. I've just got to change the view. Sorry about that, guys. Whoops. See, there we go. Okay. Yep, I was definitely not seeing your questions because there are a few here. Any opinions on Excitoso? Okay, so we are looking at Excitosa mouth device instead of CPAP. So it's a relatively new treatment. I think a lot of people do pretty well with it. And I think it's like CPAP. It's not a one-size-fits-all situation. So some people are going to get on really well with it and other people aren't. So sometimes it can be a little bit of a trial and error situation where you talk to your doctor. Again, it's really important that you discuss with them to see whether or not it's going to be appropriate for you. Because what we find is your sleep apnea severity and also the structure of your airways can really affect which treatment is actually going to work for you. So I would talk to your doctor first and see if it's appropriate before jumping in. Okay. Have you heard of many using CPAP and also mandibular advice? Generally, no, because CPAP reduces apneas or your AHI, so that's the average amount of sleep apneas you're having per hour, down to a normal level. So the average reduction is an 80% reduction, but most people will bring it down to a level where it's either completely eliminating your apneas altogether, or it's bringing it down to an acceptable level. So with that said, I have heard of people who have used both at the same time. I don't know whether there are any studies to see whether it's better for people. The problem is that mandibular advancement device can be a little bit restricting in the airways. So if you're using a full face mask, that could be problematic. It might be okay with like a nasal mask or a nasal pillow. But generally speaking, we don't recommend using two of these therapies at the same time. Okay. Any other questions? We don't even have to talk about mental health. We can talk about sleep apnea or sleep in general, various treatments. In light of new information, Philips CPAP causes cancer due to chemicals used in their noise reduction filters. So this is an extremely unfortunate situation. The sleep medicine community is pretty angry about this. So all of us in the sleep healthcare space, so sleep specialists, sleep physicians, sleep scientists, are just completely dumbfounded about how this could happen. I will tell you from like my point of view, it has affected a lot of my clients personally. I have several people who have had their machines recalled. It's taking forever to get new machines to them, and this has a lot to do with the manufacturing issues right now. And also their insurance is unwilling to put them on other therapies or put them on another machine. So if that has happened to you and you are without treatment for an extended period of time, then I would highly recommend seek information on whether another form of treatment is appropriate for you, because the last thing you want is to be off treatment for a really long time. And this recall could unfortunately go for a while. So one thing I would recommend is call around to dentists in your area to see whether they practice sleep medicine, and just discuss the issues you're having with your machine. Discuss, whether it may be appropriate for you to switch over to something like a mandibular advancement device or another oral appliance. You could also talk to your primary care physician about being evaluated for surgical options. So there's over 20 different surgeries for sleep apnea. Again, it really depends on your personal situation. So it's going to depend on your anatomical features in the throat, what's actually causing your blockages in the first place. Surgeries quite successful depending on what is causing the issue. Inspire is getting more popular. It's being covered by more insurance, and it's also pretty good at treating moderate to severe sleep apnea. So previously we reserved CPAP for those really severe cases, but Inspire also works quite well. So again, it's really important to talk to your doctor. Tell them that you're struggling. Look to see if there's any other options. Look to see if you can get onto a new machine altogether. There's a few major CPAP suppliers that have nothing to do with Philips, so this would be places like ResMed, for instance. So it really just depends. Okay. Any other questions? But yeah, the thing with Philips is just like mind blown. We are just so disappointed. And the thing that drives me nuts is it puts people off using CPAP, even more than CPAP puts people off using CPAP. So it's been just, we're very dumbfounded. Okay. right, guys. Well, if you don't have any more questions, thank you so much again for joining me. So, sleep and mental health is one of my absolute passion topics. It's one of the topics I studied for a decade when I was doing sleep research. Oh, we've got another one. Any link between sleep apnea and cancer? Yes. So, the link between sleep apnea and chronic diseases is actually an incredibly well studied topic. Now, with that said, we've only really made that link within the last 10, 15 years. But we're starting to understand more and more about how bad sleep apnea is for your body. So most people know that sleep apnea raises your risk for cardiovascular problems. It raises your risk for most forms of cardiovascular disease by 140%. So that's huge. But the other chronic diseases people aren't super aware of. So that is certain types of cancer. In particular, it raises your risk for melanoma, breast cancer, kidney cancer, pancreatic cancer, and a handful of others. And the reason for this is because sleep apnea, when it causes those dips in your oxygen levels, that's called hypoxia. And the chronic hypoxia all night long causes a massive inflammatory response. And this inflammatory response puts a lot of stress on your cells all around your body. And when cells are really stressed out, they're more prone to becoming cancerous. There's a lot of other science that goes into this, so that's a very simplified explanation, but it does raise your risk for cancer. The last figures I saw was it elevates your general risk for cancer by about 4 times. That figure has probably changed recently as we do more clinical studies. But we also know that people who go on an effective sleep apnea treatment reduce their risk down to a normal level. Okay. Yep, every Wednesday at 8:30 Eastern Standard Time. I'm on the East Coast, so I try to do them as late as possible. If you guys are interested in specific topics or you'd like me to discuss something or answer specific questions, feel free just to private message me or leave a comment on the page. I'm happy to cover whatever. Generally I try to keep the topics relevant to sleep apnea because most people who are coming to these topics are coming because they have sleep apnea. But I'm happy to discuss any other sleep topics unrelated to sleep apnea, so just give me a shout and I will take it into consideration. Okay, well, I think I'm going to end this webinar tonight. Again, thank you guys so much for tuning in. Like I said, sleep and mental health it's one of my biggest passions. I love this topic. I'm fascinated by it. And I'm happy to chat with you offline if you have more questions or you're struggling or you need some help. So again, take care and I will see you next week. No worries.